Hey everyone, my name is Sarah Hornsby and I am a dental hygienist and a myofunctional therapist. And I wanted to make this video because I know that now there's so much information on myofunctional therapy and there's so many courses, there's so many people out there talking about it that I just wanted to share a little bit more about me and who I am and a little bit more about my course that I created about 6 years ago now called MyoMentor. So the MyoMentor program is a 12-week course. I've been teaching it exclusively online pretty much since 2016, 2017. And it started off really small and focused on dental hygienists, and it's evolved into this really amazing, extensive, big program with over 700 graduates at this point. And today, I don't only offer the program to dental hygienists, that's how it was originally started and created. Today, I offer the program to dentists, speech pathologists, occupational therapists, physical therapists, pretty much any healthcare provider who's interested and who has the ability to practice and teach their patients exercises. So MyoMentor has been around and it's been online long before COVID. So all of our systems with videos, the online platform, and so much more are tailored and have always been tailored to online education. So I've had over 100 dental teams, meaning an individual dentist or a dental practice, take the MyoMentor program. So really a lot of the focus these days is around not only the independent practitioner, but also how do you do and deliver myofunctional therapy in a dental practice or dental office setting that might be integrated with more things like orthodontic treatment or sleep apnea treatments or TMD treatment. So we talk about that a lot in the course. It doesn't mean the course isn't a good fit for you if you are a speech pathologist or physical therapist, because so much of the field is focused around dentistry and airway and the craniofacial complex and structures that whether you come from a dental background or a non-dental background, I actually think the non-dental people get so much out of this course because it's not the typical class that you would take as a physical therapist or a speech pathologist. It's going to give you some insight into our world and what we're doing, what my background is, what I do in my practice, and what we're doing every day in dentistry when it comes to airway, sleep disordered breathing, sleep apnea, snoring, tongue tie, and myofunctional symptoms. So the really amazing thing about the course these days is that we've added so much more content. So what started off as a pretty basic 12-week course 5 years ago is now cram-packed with so much information, and it's all research-based. It's based off of my clinical experience running my practice with 5 myofunctional therapists working under me. It's my experience teaching and educating and all the things that I've learned over the past 11 years as a practicing orofacial myofunctional therapist. It's all the things that I've learned from working with Dr. Zaghi and the Breathe Institute and so many other amazing experts in the field. So it's all of that information put into a 12-week course. And in 2022 and moving forward, we've changed the modules. So we have 3 modules for the MyoMentor program. The first 5 weeks is module 1. That's where we talk about symptom identification. So how to look at your patient and know that they need myofunctional therapy, how to identify their symptoms, whether that's breathing issues, tongue tie issues, whatever their myofunctional concerns are, that's what we focus on identifying in module 1. Now for the following 7 weeks, we're really focused on treatment. So not just the basic treatment, but how do you treat and how do you work with so many other modalities? So how do you integrate orthodontic treatment, sleep apnea treatment? If you're coming from a speech background, how do you fit the myofunctional component into what you're already doing as a speech pathologist? We're also looking at how to structure the therapy around specific appliances like the Alpha appliance or the Vivos appliance. So there's so much more that I've had to add to the course over the years, and it's a really well-rounded, robust program. Not only do we have the live in-person calls twice a week focused on symptom identification in module 1 and the treatment and actual therapy techniques in module 2. Now we've shifted module 3 to completely on demand, access it when you're ready to or whenever you want from the beginning of the course. That is module 3, and it's focused on practice management, running the business, knowing how to charge, what to do about insurance. And those are all in 5-minute video clips that you can watch at any point to get that question answered. So what I've found is that over the years of teaching this, there's a lot of people that practice in different settings, and some of the students are opening up practices and starting their own myofunctional therapy clinic, while others are working out of a dental office, and they're two very different settings. So that's why we've moved module 3 to completely on demand, and that way you can access the videos and the content that makes sense for you in the way you're practicing it. So the feedback from students has been amazing. We've had over 700 graduates now. The majority of those are dental hygienists, but at this point, there's probably been at least 100 dentists and other professionals who have also gone through the program. So it's very exciting. I would love to have you join. Please reach out to us if you have any questions, if you'd like to know more about the program, more about me and my experience and background, more about any of the therapists that I have practicing under me or working for me to help support MyoMentor graduates. We've got an amazing team here at Faceology and MyoMentor, and we'd love to have you on board to join us and be part of that team and family. Thank you so much for watching this video. I hope you learned something new, and I'd love to learn more about you, so please feel free to reach out. I'd love to see you in the next class.